This is the what I call it the common usually no. They can try to continue no problem. They music no, smell no, and also yeah, kind of aspiration to life. It's not specific.
Children with Autism Spectrum Disorder. Please welcome Dr. Ahmad Zamir, Cik Doktor, our passport.
Assalamualaikum, Doctor. I think you can start sharing your materials.
Right, sure. Right, okay. Assalamualaikum warahmatullahi wabarakatuh and very good morning to all. Before we start, can I test the mic? Do you hear me, Puan Zarina?
Yes, I can hear you clearly. I think you can proceed.
Right, okay, thank you very much. Okay, all right. Assalamualaikum warahmatullahi wabarakatuh and very good morning to all. Okay, I would like to thank to National Autism Resource Center for the opportunity for sharing this nice topic with the parents and the teacher, because I know that this topic is very important for the teachers and parents out there. Okay, thanks for the introductions. And as you know, my name is Ahmad Zamir bin Cik, just call me Zamir, and I am actually a lecturer in the Center of Occupational Therapy from Faculty of Health Sciences, Puncak Alam campus. So for today, I'm going to share with you my experience as well as the current technique that we can use to improve self-help skill in the children with autism spectrum disorder. All right, so I'll try to make it simple as possible so that it will be easier for the parents and teacher out there to apply this technique to the children with autism at home or in the school. All right. So basically, this is my presentation outline. So of course, before we start before we proceed with the self-help skill, learning the technique to improve self-help skill, we have to know what is self-help skill, and we have to know about the development of self-help skill, start from the birth until the child age 7 to 8 years old. And I will also discuss the technique and evidence how to that normally used by occupational therapists and other professions to improve self-help skill. And the next one, I will provide a simple tip for parents and teacher. All right. So what is self-help skill? So basically, self-help skill is skill required in everyday independent living. So it is skill to promote independence as well as to promote survival skill of the child with autism. Okay, and it is also named. It is also known as independent living skill (ILS) or daily living skill. All right. So this is the other term that normally used. Being referred as self-help skill. All right. But you should know that there's a lot of people as well. They use the word adaptive behavior. Actually, adaptive behavior encompasses the daily living activities, and it includes socialization, communication, and daily living skill. Meaning that the self-help skill is under the roof of adaptive behavior. All right. All right. To the parents out there, why a self-help skill is very important. The first one is, of course, to promote independence in the child with autism. So, of course, when the child able to do their daily living tasks independently, it will decrease parenting stress, as time and energy needed to manage the child will be decreased. And self-help skill is very important because it is a prerequisite to integration to daycare and school. So we are quite lucky now in Malaysia because Ministry of Education have enforced zero reject policy, right? So zero reject policy means that every child have opportunity to be in the special school, even though she or he still have problem in daily living skill. Okay, previously those who have problem in daily living skill such as toileting, dressing, or self-dressing, the school is quite refused to take the children to be in the class of special needs. Okay, and of course self-help skill is very important for employment, so it's a prerequisite in employment. So of course those need to go forward, they have to be able to manage themselves, dress themselves, all right. And of course if the child able to do daily living skill independently, it will reduce life costs and improve the well-being of the child itself. All right. So this is common complaint that I received from the parent. Okay, my child could not do toothbrushing, toileting, tolerate with haircutting, attending school and reading, although he is 9 years old already. So this is common problem that are reported by parents in occupational therapy clinic. All right, so this is the common problem faced by children with autism spectrum disorder. So the first one is eating. Toileting, showering, hygiene, grooming, and dressing. And this daily living skill is sometimes associated with the sensory issue of the child, because it is common for the children with autism to have a sensory issue. And then this is the first 6 picture is actually the basic self-care, and the next one is much more difficult, which is sometimes we call it instrumental activities of daily living, which is complement to the self-care activity or activities of daily living. All right, so it was reported by a research that 56.4% of the children with autism aged between 10 and 7 years old still have self-help skill deficit. So actually treating self-help skill in the children with autism, I think is much more difficult than other developmental disabilities such as Down syndrome, specific learning disorder, dyslexia, or other developmental disabilities such as cerebral palsy or other syndrome. It is much more difficult because of the spectrum of the children with autism itself. Okay. And of course, we should consider a few factors when we intervene for the self-help skill in the children with autism developmental disorder. Okay, of course, self-help skill is associated with cognitive functioning of the individual. The better cognitive functioning of the individual, the better daily living skill activities of the children. Okay, and it associated as well with the severity of the symptoms. symptom. If the children have very severe symptoms, so of course the daily living skill have a lot of problem, and daily living skill also increase with the age. So as the child getting older, the better the daily living skill of the child. And as I told you earlier, sensory motor deficit as well as language skill also influence the self-help skill of the children with spectrum disorder. All right. So now, why we have to learn a little bit about development of self-help skill in typical children, because we want to know the milestone of the development. So at what age this child should be able to do this and this. Okay, so that's why we need to know the normal developmental milestone first before we teach the children on self-help skill. All right, so basically this is the development of self-help skill in typical children. So at the age of 0 to 6 months, the child should be able to track object with eyes, coordinating suck and swallow, and breathe sequence, and she or he should be able to sleep for 4 to 10 hour interval, and they communicate with us through crying to indicate whether she is hunger, fear, or have discomfort. Okay. So what are the possible implications if the child did not achieve the milestone of normal development? Okay, they may have difficulty with breastfeeding. They also may have difficulty with settling to sleep, and they may cry often. Okay, so this is why we need to learn about the development of self-help skill. Okay, and then we move to the next, okay, which is at the age of 6 to 12 months. The child should be able to play for 2-3 minutes with a single toy. They should be able to sleep for 10 to 12 hours with only one awakening, and they can tolerate with a range of different texture foods, because as you know that it's very common for children with autism to be a picky eater. So if they cannot tolerate with the different texture of food, that will be very difficult for the parent as well as for the child to get a better nutrition. Okay. And at this age as well, they should be able to drink from a cup and hold a bottle or cup independently, and feeding small cracker or other small pieces of food, for example, spaghetti or macaroni. They should be able to pinch and then bring the food to the mouth. Okay. All right. And if they did not achieve the milestone, they may have difficulty settling and wake often during at night. They may have difficulty socializing with parents, and they may also have problem in shared attention, or in occupational therapy we call it joint attention. Shared attention is referring to a shared attention to a specific task or specific object. This is very crucial because in order to teach self-help skill to the individual with autism, the prerequisite thing is a shared attention. The child should have shared attention. Okay. And they also may struggle to copy and learn from others due to poor understanding and attention. They may also have difficulty in feeding, holding cup or bottle for drinking, and they may have difficulty tolerating with different texture of food that will lead them to be a picky eater. Okay. All right, so I will touch a little bit the intervention to treat a picky eater after this. Okay, all right. So the next one is 1 to 2 years old. The child should be able to distinguish between what can be eaten and what cannot be eaten, and they can imitate adult behavior, and they can engage in imaginative play. They're aware of parent approval and disapproval through our expression, and they, at this age, they also can tolerate with nappy changes, settling themselves to sleep at night or during day, and they attempt to brush teeth, knowing where familiar items are kept, and they can cooperate with us during the dressing by extending their arm and leg. Okay, they start to cooperate with us during the dressing activity, and if they did not achieve the developmental milestone, they may have this possible problem. The first one, they may have difficulties difficulties to copy and learn from others due to poor understanding and attention. They may have difficulties feeding self. They may have difficulties holding onto and drinking from cup or bottle, and they may have difficulty tolerating different texture food. This is actually a vice versa to the developmental milestone. Okay. All right. To the next slide. At the age of 2-3 years old, the child should be able to using toilet with assistance from the parent or from the caregiver, and then they should be able to look at food independently. They can unbutton large items during the dressing. They can express their emotion, whether they are sad, happy, or angry, and they should be able to distinguish between pee and poo, and they should be able to use a napkin to wipe their face and hand, and they should be able to feeding self meal using a fork and spoon. So at this time, they should be able to use spoon and fork, and they can take sock and shoe off, and they can enjoy or tolerating with messy play. Right. All right. So possible complication if they did not achieve the milestone is they may struggle to copy and learn from others. They may have difficulty following instruction. They may have difficulty in feeding self, learning to undress self, and may have difficulty getting to sleep through at night. All right. And the next one is at the age of 3 to 4 years old, the child should be able to feed self independently, meaning that there is no assistance at all from the parent or from the caregiver or from the teacher or from the domestic aides. Okay, they can tolerate with different clothing, texture, and shape. So this is very common among the children with autism because they have sensory issue. So this problem is very common among the children with autism. They can do independently packing item away. They can toilet independently at 3 to 4 years old. So we can always train the children to do toilet training at the age of 2 to 3 years old. And for the dressing, they only require assistance with lace, button, and other fastener in awkward place. For example, at the back, at the side, okay. If it's in front, I think the child should be able to do it. And at this age, their social development become larger, and they start to engage in 2 to 3 children to play with 2 to 3 children in a group, and they can start with brushing teeth, and they also know how to taking turns. This is a very common social skill that the patient with or the children with autism spectrum disorder have problem with. And the last one is they can settling themselves to sleep at night. Okay, so what are the possible implications if they did not achieve the milestone? Okay, they may have difficulties socializing with peers. They may have delayed play skill. They may struggle to copy and learn from others due to poor understanding and attention. They may also have difficulties maintaining attention and toilet training, dressing, and feeding themselves. All right, to the older age, okay, which is 4 to 5 years old. So at this age, the child should be able to develop friendship. The social circle of the child become larger, and they know how to follow the rule. They can choose weather appropriate caregivers according to weather, but this is of course not applicable in Malaysia because most of the developmental milestone was developed in the Western countries who have 4 seasons. So this is actually not applicable to the Malaysian population, and they can dress self-independently, and they can play with 4 to 5 children in a group. So it's become large. The social circle of the of the child is become larger at the age of 4 to 5 years old. And if they did not achieve the milestone, they may have difficulties in socializing, have difficulties expressing what he or she wants, needs, and thought and idea. Okay, and this is very common among the children with autism spectrum disorder, especially those without verbal skill. Okay, so sometimes it's very difficult for the parent to understand their children because we don't know what they feel, what is their emotion, because they could not talk their emotion. Okay, so that's why it's very difficult to manage the child with autism spectrum disorder. Okay, they may also have difficulties with self-care tasks such as dressing, feeding, and toileting. Okay, all right. To the next, to the older age, okay, at the age of 5 to 6 years old, the child start to engage in kindergarten or start to go to daycare. So they can do a morning routine at school. For example, putting a bag away and put drink bottle in correct spot in the bag. They can also open lunch box, ziplock and food packaging on their own, and they can sitting at desk, following teacher instruction and independently doing in-class assignment, exercise, or anything that the teacher asks he or she to do it. All right, and at this age, they also can coping with busy environment. So we can say that at the age of 5 to 6 years old, the child should have selective attention. Okay, so meaning that they can disregard other distraction and only focus on the certain task only. Okay, and the next one is they can settling independently for sleep, and they can packing a bag for school or other outing with assistant. So it's required assistant to packing a thing. All right. So let's say that the developmental milestone is not achieved. This is the possible problem that the patient have, okay, or that the child have. They may have poor attention and concentration. They may be easily distracted and have difficulty sitting still. So this is related to attention of the children. They may have poor organizational skill. They may have delayed fine motor skill, and they may demonstrate difficulties in coping in busy environment. Okay, right. Okay, to the older age, from 6 to 7 years old. So at this age, the child should be able to independently get himself to sleep through the night. So at this age, they don't require any help to go to sleep or to go to bed. Okay, they can shower independently. They can packing a bag for school or other outing with a little assistant. Okay, to look for the schedule of the school. Okay, schedule of the subject. Okay, they can independently toileting during the day and at night. They can telling time. Okay, they start to they can start to let you know what time is now, and they know where's their body in time and space. So then they know where is left, where is right, where is the location of the body, and they also can prepare simple meal, for example, cereal. Okay, if the milestone did not achieve, they may have this possible problem. They may easily distracted or have difficulty sitting still. This is related to attention of the child. They may have poor organizational skill. They may have difficulty self-care tasks such as dressing, feeding, and toileting. All right. to the older age, from 7 to 8 years. At this age, the child should be able to recalling event and describing them. Okay, so at this age, the child should be able to tell you the story, what happened in the school, what happened in the daycare, or what happened when they are with their friends. So at this age, the typical children normally can describe or can tell you a story about themselves, and they can remember a sentence to write, and that was just talk about or told. So meaning that at this age, the child should be able to have a good working memory in the health sciences. We call it working memory. Okay, they can attending for longer period of time. They should have more attention span or concentration. They can taking on more responsibilities in doing household chores. They can understand how to use money. They can tell in the time and displaying time management skill. Okay, they can do the schedule. They can prepare simple meal, for example, cereal and sandwich. And if they have, if the milestone did not achieve, they may have this possible issue. They may have a problem in expressing thought and idea verbally and in written form. They may be easily distracted and have difficulty sitting still. They may demonstrate poor organization skill, and they may have difficulty in self-care tasks. Okay, all right. So as for Malaysian, I know that in this group, we also have somebody from United Kingdom, somebody from Thailand participating in this webinar. So this is actually for Malaysian mother. So do you still remember the pin book that you have when you go for your appointment, for your first time appointment when you get pregnant? So this pin book is actually have a section that can track developmental milestone of your child. Okay, for example, here as we can see on the picture, at the age of 14 to 12 to 22 months, the child should be able to undress him or herself. Okay, so tip number one for the parent and teacher out there. So of course, in order to teach self-help skill to the children with autism, you should follow the developmental milestones. So you should know which skill you should teach first before another skill. Okay, please don't teach too advanced skill to the child. So because it will create a lot of failure, and it will decrease the motivation of the child to participate in our therapy session. All right, so actually I'll just put this outcome measure. Okay, this is intended purposely for the occupational therapists out there, or for the professional out there. You can use this outcome measure in order to evaluate the effectiveness of your intervention with the child with autism using this following outcome measure. So I categorize it into a few categories to assess the domain of ADL. IADL is instrumental activities of daily living, play, goal, and the type of assessment. PB referring to performance-based, OB referring to observational-based, CR referring to clinician-rated, and SR referring to self-rated, is either rated by the parent or by the children themselves. Okay, all right, and I would like to highlight this good assessment, which is mainly to assess adaptive behavior of the child. Okay, meaning that it also assess self-help skill of the individual with autism. It also assess other two components of adaptive behavior, which is socialization and communication skill. So, but to use this assessment, so of course you need to purchase, and you need to have certified qualification, at least a bachelor degree, to conduct this assessment. Okay, all right. All right, and let's proceed to the technique and evidence in literature. Okay, so what are the common techniques that we can use to improve self-help skill of the children with autism spectrum disorder? All right. So there are two approaches in the therapy. So of course, we have family-centered therapy and individual therapy. Okay, so family therapy is referring to the involvement of parent and caregiver and participation of parent or caregiver in the delivery of intervention, while for individual therapy is referring to involving of the only child and therapist in implementing the intervention. Literature suggests that moderate evidence on the effectiveness of family-centered therapy. This is mainly because of the compliance of the parents or caregiver in doing the therapy session to the children, while for the individual therapy with the therapist, literature suggests strong evidence for the effectiveness of the intervention. So of course, individual therapy is over than family therapy. All right. So these are few techniques that we can use to improve self-help skill in children with autism spectrum disorder. Okay, the first one I would like to share with you is video modeling. So video modeling is a very common technique that usually used with children with autism spectrum disorder, and you just need to show a child a videotape of person engaging in target skill. Okay, so we can discuss about video modeling later. All right, and then training. Training is another technique. Training is to teach a multi-step or complex skill using either total task training, backward training, or forward training. So training basically is what I can say is training is actually breaking down a task into small steps, so that it will be easier for the child to accomplish the task. So meaning that in order to use the training, you have to teach the child step by step. Okay. All right. The next one is prompting and feeding. Prompts are used to increase a child to provide a desired response, and feeding is gradually reducing the prompt. So of course, when we prompt the child, and we need to feed the prompt in order to make the child independent. So I will discuss about prompting and feeding in my next slide. Okay, so this is just a surface, so you have no worries if you does not understand this slide. Okay, and the next one is graduated guidance. It's similar to the physical prompting, but it's designed to teach behavior which require physical assistance, and it also named hand over hand technique. So meaning that in performing the task, you put your hand over the child's hand and help the child to perform the task and experience the task. So that is what we call it graduated guidance. And the next one is self-monitoring. So this self-monitoring is advanced skill. It is quite advanced to be applied with children with autism skill, because if you want to use this technique, at least the child should be able to follow instruction, should be able to only have a mild cognitive problem. Okay, and the most common technique that we use in improving self-help skill for the children with autism spectrum disorder is reinforcement. So reinforcement is a reinforcer that increase in the future frequency of that behavior or targeted behavior. Let's say that your target behavior is to ensure that the child should be able to brush her teeth independently. So meaning that that is the target behavior, and you can reinforce or use reinforcer in order to encourage the target behavior. It can be praise, it can be positive word, it can be sticker, it can be token, it can be an activity that the child like. Okay, so we can they have a few classification of reinforcement. Okay. All right. The next strategies or technique that commonly used by the therapists out there is physical exercise. So evidence suggests that children with autism need to participate in swimming, jogging, horseback riding, cycling, weight training, walking, and yoga to improve their social communication skill as well as self-help skill, and of course to prepare themselves for school. Okay, and the next one is co-op. Okay, co-op is an co-op is stand for cognitive orientation to daily occupational performance. This is an individualized family and client-centered approach that use guided problem solving to assist the children and youth to acquire generalize and transfer the skill. Okay, for the co-op, the therapists need to be trained in using the co-op because before they can use the co-op, actually I'm in the midst of in the process for the certification in co-op. So at the moment, I just passed level 1 and level 2, and I'm still working on level 3 and level 4. Okay, so in the co-op, they teach the child on goal, plan, do, and check. This is the global strategy that is used in the co-op. So when let's say that the child choose to be independent in toothbrushing, so the goal of course toothbrushing, and then the plan is how the child plan to perform the activity, and the child then need to do it, and the child need to check it whether he or she able to do it. Okay, why we co-op is very difficult to be applied with the children, because of course in using the co-op, the prerequisite skill of the children, they need to at least have a good cognitive function and should be able to follow instruction, meaning that co-op is not suitable for those children with profound or with severe IQ level. Okay. All right. The next one is OT sensory integration. This is a common technique that are used by occupational therapists out there, and I believe that there's a lot of OT applying this technique to the children with autism spectrum disorder. It is a manualized protocol that can promote decreased assistance needed for the self-help task. Okay, and it is performed in clinic-based intervention and conducted by professional occupational therapists. So this skill cannot be transferable to the parents, because only occupational therapists can do it to the children. All right. Okay, so as for therapists out there, and then for the occupational therapy student who are engaged in this session, you should be able actually to differentiate between sensory-based intervention and sensory integration therapy. So this is actually the differences between sensory-based intervention and sensory integration therapy. Okay, let's move to the training. Okay, because I would like to focus more on giving the information to the parent. So I'll just keep the slide for the difference between sensory-based and sensory integration therapy. So as I told you earlier, training is actually a task to break. Is training actually a step that we can use to break down the task into small steps. Okay, for example, I'll provide you with an example here is brushing teeth. Okay, so brushing teeth, there is a 5 step. Okay, so the 5 step is the small step in the brushing teeth. Okay. Okay, for example, step number 1, the child should wet the toothbrush, and the second, they should put the toothpaste on the brush, and then they should brush the teeth, and then number 4, they should spit in the sink. Okay, and last one, they should rinse the toothbrush. Okay, all right. So that is the definition of training, and in the training, there are three different types of training. Okay, the first one is total task training. Total task training means that if you walk all the step to the child, or if you do all the step to the child, we call it total task training. Okay. And forward training is when you teach the first step to the child. So meaning that the child should do the first step, and the last four steps in the brushing are completed by you. Okay, so this is the definition of forward training, meaning that you teach the first step first. Okay, so when is to use a forward training? Okay, for you, a forward training is very good to improve the momentum of the child, or to improve the motivation of the child. Okay, because why? Because the first step normally the easier one. So let the child do the first step first, and then you complete second, third, and fourth. 4 and 5 step, and let's say that the child able to do the first step, and then you need to ask the child to do first two step, step number 1 and step number 2, until she or he can complete all the steps in the training. Okay. And actually, for the backward training, it is reverse to the forward training, where normally we will teach the last step to the child, or the child need to do the last step, and the first 4 steps will be done by you or by the teacher or by parents. Okay. All right. Okay. So when is to use backward training? If the child can complete the last step, so you can use the backward training. Okay. And the good thing about using the backward training is because it's to the ultimate goal of the task. So after they complete the last task, we can celebrate it, or we can provide the reinforcement, and this is also can improve the motivation of the child to engage or to improve their self-help skill. But in the training, of course, you need to have a skill that we call it task analysis skill, which is a very simple skill. Actually, it's just a skill to break down the task into small steps until it can be implemented by the child, and until it is easier for the child to do it step by step. Okay. All right, to the next one is video modeling. Okay, video modeling is very good for the child with non-verbal communication. Okay, so normally video modeling is integrate training in the video modeling. So they break tasks into small steps, and in the video normally they will use simple instruction, and the language used is a layman language that is easier for the child to follow. And the last one, the model in the video can be parents, can be peers, can be sibling, or can be the child itself. Okay. All right, and then we're going to discuss about prompting and feeding. So why I merge prompting and feeding together? Because prompting is the help that is provided by the teachers or by the parent, and feeding is the act of reducing the prompting. Okay. All right, so prompting is also known as cues, hint, or checklist. Okay, and the type of prompting, it can be physical, verbal, modal, gestural, visual, positional. Okay, for the physical, when you physically guiding to perform skill. Okay, as we discussed in graduated guidance just now. Okay. All right, and the next one is verbal. Okay, verbal, you can prompt the child by providing the verbal instruction, okay, or by providing the feedback to the child. For example, well done, you did a good work, okay. All right, and the next one is modal. Modal meaning that you have to demonstrate the desired skill. Let's say that you want to teach feeding independently. So you have to demonstrate to the child how to bring the food from the plates to the mouth. Okay, and the next one is gestural, when you use your gesture. Okay, your gesture, your body language, for example, pointing to provide the cues or provide the prompt to the children. And the next one is visual. Visual can be a picture, symbol, or text. And lastly is positional, is the placing of material in a location or sequence. Okay, all right. The next one is fading. Fading is actually the act of reducing the prompting. Okay, so the first one, we as a teachers or we as a parent, we need to know when we should reduce the prompt. Okay, so it can be graded by force, time, and speeds. Okay, for the force, for the physical guidance, so of course we can start with the high physical guidance to low physical guidance. Okay, for the time, we can start with immediate to delay prone. Okay, for example, we can automatically we should start with the direct instruction, and then after that we should move to the delay prompt. Okay, and the next one is the space between the child and you or a parent or teacher. So probably during the first skill teaching, you have to sit close to the child and gradually away from the child as the child progress. Okay, so that's why we can maintain the self-help skill in the children with autism. So we should use prompting and fading concurrently. All right, so this is an example for you to better understand about prompting and fading. All right, so the first picture here, if you can see my cursor, okay, this is the visual cues for the dressing. Okay, and this is the graduated guidance. Hence, the teacher's hand is over the child's hand in order to help the child to write. And the next one is the therapist use the gesture to points or to provide a prompt to the patient. And this is the example of cues as well. And this is example of symbol that you can put in the door of the toilet, for example, or you can have another symbol to help the children with autism living their life independently, okay, if they need the visual cues. Okay, as for graduated guidance, okay, graduated guidance is intended to be used to improve motor skill and self-help skill of the children. Okay, so you as a parents, you as a teacher, so I think you know your best, your parent best. Okay, sorry, your child best. Okay, so I'm pretty sure that you know how much physical assistance is needed for your child. So you know what your child can do or what your child cannot do. Okay, so as the child in the graduated guidance, as the child progress over time, we need to fade or remove the prompt, okay, or physical assistant, okay, because we know that in the graduated guidance, only physical prompt is used as a technique to improve the self-help skill. So example of activities that use graduated guidance are hand washing, feeding, toothbrushing, fine motor tasks, and street crossing. Okay, and as we discussed before about the self-monitoring, this is actually intended for high-functioning autism children. Okay, so the target behavior in the self-monitoring, it should be observable and measurable, and then we should have recording system. For example, on this slide, you can see the way the child recording their behavior. Okay, for example, let's say that let's say the child have normally like to scream in the class. Okay, so the target behavior that we want to reduce is no screaming. So meaning that that is the target behavior, but we have to put it in a positive way. So instead of no screaming, we should put it as use indoor voice. Okay, so make it positive for the child. Okay, all right. So for example, this child put it never, 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 meaning that at the end of the day, you can reinforce the child to improve the frequency of targeted behavior. Okay. All right, and the last one, I think this is the last one, is reinforcement. Before I can share with you a few video. Okay, reinforcement. This is common technique. Okay, reinforcement. Sometimes we call it reward. Sometimes positive reinforcement. Okay, so reinforcement is actually to increase in the future frequency of that targeted behavior. So reinforcement is very important. You should celebrate what your child have achieved. Okay, so give them praise, give them something that she or he can eat, and there are few classes in the reinforcement. Okay, the first one is something that can edible reinforcer. We call it edible reinforcer, something that the child can eat. So let's say that she or he have completed brushing his or her teeth independently. So you provide a snack or biscuit to the child. Okay, sensory is you provide something that is pleasant for the sense of the child. For example, you provide music, you provide video on YouTube, and you can also provide tangible reinforcer. For example, sticker, money, token to the child. Okay, and you can also use activity reinforcer. Just provide activity that the child like to. So that's why in teaching occupational therapy students, I always remind them to always evaluate the child interest before they provide the intervention to the child, so that they can use the activity as a reinforcement to the child. Okay, and the next one is social. Okay, for the social reinforcer, it can be praise, it can be positive word or encouragement word to the children. Okay. All right. So let's move to something specific. Okay. All right. To something specific. So let's say that I believe that there's a lot of children with autism out there. Is a picky eater or have a food selectivity problem. So what we can do when the child have food selectivity, you can use a positive reinforcement. So you can use non-preferred food as intervention. Okay, so by limiting the preferred food, so meaning that you use preferred food as a reinforcement for the child if she or he eat non-preferred food. Okay, that's what we normally use in reducing food selectivity among the children with autism spectrum disorder. Okay, another method that we can use to reduce the food selectivity or to overcome the food selectivity, if the step one or is the technique one is not successful, you may use repeated exposure or escape extinction to the children. So meaning that a child are no longer allowed to escape from non-preferred food. So the technique is you are keeping a loaded spoon in the mouth of the young child with autism until they consume the food. Okay. All right. The next one is, as I told you earlier, some of the self-help skill problem associated with sensory issue of the child. So Of course, the issue of oral sensitivity need to be intervened first before the patient, before the child can engage in doing self-care skill such as eating to brushing or go for hand cutting or dental exam. So dental examination. So it is very easy step that you can learn with your occupational therapist. You just need to applying pressure to the outer layer of the mouth and then to the inner layer of the mouth. Okay, so at the outer layer, you just need to stroke, you just need to put the pressure. Okay, and if you are brave enough as a parent, you can also desensitize in the inner mouth. Okay, by using your hand, or you can use the desensitization stick. Okay, as I showed on the slide. Right, so you have to do gum massage. So just pinching the gum at the bottom and at the upper part of the patient's gum or the child gum. And if you are brave enough and do not afraid of getting bitten by your child, you can also stimulate the tongue as well as the palate of the child. Okay. All right, the next thing is mealtime behavior. All right, this is a specific technique for mealtime behavior. So normally in literature, to improve this mealtime behavior, most studies use shaping, which are a combination of training and reinforcement. And few studies also use graduated guidance, prompting and feeding, and last one is video modeling. Okay. All right, for the dressing, it's similar with the mealtime behavior. Normally, literature suggests to use prompting, feeding, and reinforcement together in combination. Training and graduated guidance, especially with profound intellectual disability, which their IQ is less than 20. All right, video modeling. And of course, modeling demonstrated by a peer, by the by sibling, or by the parent themselves. All right. For the personal hygiene and grooming, the normal literature suggests the parent to use prompting with the feedback and reinforcement from the parent, and then verbal instruction, reinforcement, and physical prompt. Okay, literature also suggests parents to use visual cues, prompting, feeding, and reinforcement. And last one is modeling, demonstrating by a peer. Okay, for the toilet technique, for the toilet, this is the technique that normally used. First one is graduated guidance, as we discussed before. Visual cues and reinforcement, video modeling, and visual social story. Okay, I think for the Malaysian, you can look at YouTube channel of Genius Gunya. They have a video on toilet training that use visual social story with the child and prompting and feeding technique with the child. Okay, you can Google or you can search on YouTube. All right. So in general, so what I can say is to the parents and teachers out there, this is the simple tip that I can provide to you. Okay, the first one is in order to improve self-help skill of the children with autism spectrum disorder. So of course you have to teach the skill according to self-help skill development. Okay, so as we discussed before, we need to know the development of self-help skill. So of course we need to follow that milestone. Okay, so don't teach too advanced skill to the children before the age. Okay, because it will create frustration to the child. Okay, the next one is shared attention. So of course, in order to teach the skill to the children should be able to have attention on the task or on the object. So get the attention first from the child. Okay, the next one is motivation. Okay, all right, so how to improve the motivation of the child? So you should offer a choice. So for example, I provide an example. For example, that let's say that in teaching dressing to the child, so you can offer an option to the child, which clothes or which shirt do you want to wear. So that's one. It will increase the motivation or engagement of the child in the intervention or in improving the self-help skill. Okay, all right. Tips number 4 is use chaining or break down the task. If the task is complex, break down the task into small steps. It can be 5 steps, it can be 7 steps, it can be 3 steps. Okay, it's depend on you and it's depend on the ability of your child. Okay, and the next one is visual cues. Okay, so of course for the non-verbal autism child, visual cues is very important. Okay, so you can use verbal cues, image for each step. Okay, or you can use verbal social storybook to the child. Okay, and the next one is you should demonstrate each step to the child. So before you want the child to perform the step, you should demonstrate to them, and then let them see the step first before they can do the step. All right, tips number 7. Okay, use simple instruction. Okay, all right, 2 words or 3 words only. Okay, let's say that let's eat or let's wash your hand. Okay, so it's use a very simple instruction. Okay, and it should be concise and very clear to the child. Okay, don't use complicated word. Okay, all right, the next one is empower. Okay, so if you need to empower and support the child to learn the skill, so always provide motivation for the child to perform the task. Okay, and the next one is the tips number 9 is feeding. Okay, as your child progress or competent in performing the step, you should reduce the prompt, physical prompt or verbal prompt during the activity. Okay, right. And tips number 10 is enforcement. Okay. Reinforcement. So as we discussed earlier, reinforcement is very important, and it is normally used in combination with other techniques. For example, prompting and feeding, chaining, graduated guidance, and normally reinforcement is used in each technique in the technique that we discussed before. Okay, so just provide, let's say that you don't have anything for your child, just provide as simple as praise or a reward. If you have something sticker, just put a sticker on the child hands. Okay, or just put a sticker in the child's book so that they can have a collection of sticker. Okay, and the next one is tip number 11 is you should be consistent with the words, start and instruction. So you cannot change it from time to time. Okay, so you have to be consistent. So let's say that for the first that you use the video modeling. So be consistent the video modeling in teaching the technique. Don't change it to feeding or prompting to graduated guidance. Okay, so be consistent with the technique that you use to improve the self-help skill of your child. And the last one is be patient. And in achieving self-help skill of individual with autism, it takes some time, and it cannot be done within a day. All right. So sometimes when you want to toilet train your child, so of course it takes you a month or a few weeks to train. So what I can say to the teachers and parents out there, be patient and be consistent with the technique that you use. Okay. All right. And this is the references and resources that I use for my presentation. You can have a look if you're interested to. And thank you very much. All right. And I would like to disseminate information about a Facebook group that I'm running. So actually, I'm running a Facebook group, Autism Therapy Cara Kerja untuk kanak-kanak berkeperluan khas, or English, occupational therapy for for special need children. So you can join this group. There's a lot of sharing, and you can ask any question in the group, and there's a lot of OT out there willing to help you. Okay, so you can post anything with regard to your problem. Okay, and I would like to share with you as well, in UiTM Puncak Alam, we have occupational therapy clinic that provide occupational therapy intervention to the pediatric population. So we have a very large clinic that have more than 5 rooms for the child with different kind of disabilities. But at the moment we are still not taking patient because of the MCO. And if you would like to do an appointment, you can always contact Puan Fatin or Afika. I think Fatin is also in this webinar. All right. And after this, I'm going to share with you a few video that shows on graduated guidance, backward, forward training, as well as video modeling. Okay, all right. I will stop sharing my slide. Right, stop sharing. Right, and then I'm going to share with you a video. All right. Give me some.
Can you do it, Doctor?
Yeah. It's fine. Give me a minute, Puan. Right. Right. Okay, can you see the video?
As for me, I can see the video.
All right, that should be fine. Okay, the first video is the video modeling technique. So this is the example of sorry. This is backward training. Sorry, I should. Okay, let's see.
Putting on her jumper. First, she picks the jumper up. Katie puts the jumper over her head and puts her head through the head hole. Katie puts one arm through the first armhole. Katie finds the second armhole and pushes her arm through. Katie pulls the jumper down. She fixes the neck and pulls the jumper down again. Katie is finished.
Next video is hand over hands technique.
Is a requirement as part of my SPED 5371 graduate course. This project demonstrates task analysis for the skill of washing hands. The skill is broken down into 17 sub-steps.
My instructional approach will involve backwards chaining because the student already demonstrates the ability to perform the final step. I will prompt the student to perform each step in the chain except for the last behavior. Reinforcers will be delivered upon completion. Time to wash hands. Here we go. Use pink. Turn on water. Get the soap. 1, 2. Scrub. Scrub your palms. Scrub. Good job scrubbing. Look at the foam. Okay, let's do the back. Scrub. Good job. Okay. The water. Rinse. Good job. All right, good rinsing. Turn off water. Very good. Okay, push. 1, 2. Pull. Very good. Dry hands. Dry your palms. Dry. Back side, dry your backs. Good. Switch. Back. Good job. All right. Let's walk to garbage. Great work, Angel. Because are you ready to practice writing your name? No, it's too hard. But it only has 4 letters. Do you want me to show you? Yeah. Okay. H-O-P-E. 4 letters. Do you think you could write the first letter for me and then I'll help you finish it? Good job writing the H. O-P-E. Get a sticker. Okay. Do you think you can write H-O and I'll finish it? Yeah. Oh, good job. And I'll finish it. P-E. See, it's not so hard, is it? All right. Can you write 3 letters? I'll finish it for you. Good job. Do you think you can write your whole name this time, all 4 letters? Yeah. Good job, huh? You wrote all 4 letters of your name.
All right. I think that's all from me, and I'll pass the ball to.
Trouble focusing on tasks. You're going to use forward chaining.
I'll pass the ball to OC.
Thank you very much, Dr. Ahmad Zami. I call you Dr. Zami. For very amazing tips regarding how to improve self-help skills in children with ASD. Since there was a network hiccup at the early of the session, I think it's appropriate if I repeat the introduction parts. Dr. Zami graduated with a diploma in occupational OT from the UiTM and bachelor degree in rehab, which was also in OT from University of Teesside, UK, and also a Doctor of Philosophy from James Cook University, Australia. So previously he was an occupational, it's hard to pronounce it, occupational therapist at the Ministry of Health Malaysia, a vice president of Malaysian Society for Hand Therapy, and also a vice secretary of Malaysian Occupational Therapy Association. And he is currently working as a senior lecturer at the Center of Occupational Therapy at the UITM. I think it's in Puncak Alam. Just now, Dr. Zami did mention about the center that they have, and they welcome everyone to go there. And doctor, one day, inshallah, I'll bring my daughter also, because I also have one special child. Okay, doctor.
Alright.
So, doctor, are you ready for the Q&A? We have a few questions from we collected from the chat box just now. Okay, so I made it for you one by one.
All right.
Okay, the first question came from Mr. Aziz. How do we bridge the gap if a 5-year-old is unable to meet the milestone?
All right. Okay. So how we should bridge the gap? Okay. The first one is to Mr. Aziz. So as I told or I mentioned earlier before, so we have to understand the developmental milestone first. So we should teach the skill that the child should competent first, meaning that if the skill, if the child still not achieve the skill at the 2 years old, for example, for self-feeding. So you have to teach self-feeding first before you teach the toileting. So you have to teach your children according to developmental milestone. Okay, so don't teach too advanced skill to your child, because it will create frustration to you as well as to your child. Okay, that's the answer for question number 1.
I think that will be answering the question from Mr. Aziz. The second question comes from Nur Zuhaila. Miss Nur Zuhaila, okay, is this assessment done by all the hospital? My son did the individual therapy in the hospital.
All right. All right. It depends on the hospital, and it depends on the budget of the hospital. If the hospital have a budget to purchase the assessment, then the hospital have the license to use the assessment. Okay, it depends on the hospital itself and then therapy center itself. Okay, so that's one is I cannot conclude, because the facilities or the assessment is in the hospital is actually different across the state and across the hospital. Okay, right.
I think that answered the question. Okay, next question comes from Miss Fatin. At what age can we start the treatment to the children?
At what age we can start the treatment for the children? As early as you can. As early as you can. When you notice there is delay in the development of your child, you should train or you should intervene the child. Okay? All right. As early as possible. Okay? So that's why early intervention is very important, very, very important for the children. Okay?
Okay. It is very clear, and you are answering.
So to Ms. Fatin, how to know whether your child have a delayed development or in self-help skill or motor skill or social skill? So you can always go to occupational therapists to do the developmental screening so that they can advise to you whether you require early intervention program or not. Okay, right.
Okay. Next question comes from Miss Helen. Tuan, sir, when should we use forward chaining or backward chaining to teach self-help skills? And what is the criteria for choosing either method?
I missed the word the word in the first sentence of the question.
Okay. I repeat. Yeah. So when should we use a forward chaining or backward chaining to teach self-help skills? Which one is
So as actually I indirectly mentioned in the presentation just now that let's say that your child have already able to do the last step of the task in the chaining, so you can use backward chaining. All right. So let's say that your child is able to do the first step and then cannot do the step the rest of the step. and you may start with the forward chaining. Okay, forward chaining is very important because forward chaining is good to improve the motivation of the child, because the first step actually the easiest step in the a series of steps. Okay, all right. So you can reward after the child able to do it. Okay, all right.
I hope that answer Miss Helen's question. Okay, there is one question come from Miss Marina. Can we incorporate the OT approach with the use of mobile technology? If yes, can you suggest how can it be done?
All right. So, Marina, a good question from Marina. So, can we use OT approach? For example, modeling. Okay. For example, modeling. Okay, we can use with the we can incorporate with the current technology. So, of course, I think we can develop a lot of software to improve self-help skill of the individual. So let's say that we can develop a software on social story or video modeling to teach self-help skill of the individual. So that is very good. And of course, I am occupational therapy by background. I am not competent in developing the software. So of course, I need help from software developer in order to do that, and it will create a huge impact to the autism community. Okay, especially to those who needs visual cues or video modeling in the treatment to improve the self-help skill. Okay, right.
I think our NRC will be very happy to work with you, Doctor, because some of our members are in the field of multimedia and software development like that. Maybe we can sit together later, Doctor. All right. The next question comes from Mr. Yin Su. Can you explain the technique for specific feeding, repeated exposure causing escape extinction? What is this?
Oh, I see. Repeated exposure. Repeated exposure for escape extinction, meaning that point E is actually my friends, a very senior occupational therapist working in Kuala Lumpur General Hospital. I think if this is the Miss E Suim. Okay, so Miss E actually repeated exposure or escape extinction is like we force the children to consume the food. So meaning that we put the food in the non-preferred food in the spoon, and then we put in the mouth, and then let the child consume the food, and then let them taste the food. Okay, and we start for a while, and then after that we repeat again. So until the child comfortable in consuming the foods. Okay, and then of course in the escape extinction you can integrate with reinforcement, meaning that if the child did not spit the food out from the mouth, okay, you reinforce the child. Okay, you can give non-preferred food, or you can provide any rewards to the child. Okay, so that will increase the targeted behavior that we want to achieve.
Okay, I think hopefully it answered the question. It's very completed answer. All right, Mr. George asked about teenage son. I think his teenage son unable to express the need during meltdown. Do you have any suggestion?
All right. It's during meltdown. Okay. All right. So. I think Mr. John, I need to know more about your child. So probably your child does not have verbal communication. So that's why they have always have meltdown. So what I can suggest to you is to use visual cues, okay, to let the child express their emotions. But because you don't know what your child wants and what is the child emotion and what your child unhappy about something, certain things. So of course, you need to use visual cues so that the child or your child can indicate their emotion or their he or she wants. Okay, sometimes the meltdown is because of the needs of the child is not fulfilled, so that's why it has a behavior problem. But I think, of course, in order to overcome with the meltdown, I think it's better to have a session on behavior management. Okay.
Okay, it's very complete answer. So next question, this is question number 9, comes from Miss Nur Azilia. She's my friend.
Oh.
Should 6-year-old
I think I know her.
you know her? Maybe she has contacted you before. Should 6-year-old kid IQ assessment test to know the readiness to enter aliran perdana school or PPKI?
All right. Yeah, it depends on you. All right. There's a lot of clinical psychologists out there that you can go to assess the IQ test of your child. Okay. All right. If it's the situation is not worrying, so you don't need to go for IQ test. Okay. But if you think is you need to go for that, and then you just need to go. Okay. All right.
Okay. I see there is the continuity of the question from Mr. Josh like just now. Mr. Josh asked about teenage, his teenage son unable to express the need during meltdown. Son like to chew in finger until cause infection, which he is get irritated. So that's a problem with the son. Do you have anything to add to Mr. Josh?
Sorry, I missed the first few words in front of the question.
Just now, Mr. Josh mentioned about his teenage son unable to express the need during meltdown. Okay, now his son like to chew in finger until cause infection, which he is getting irritated.
All right. Okay. So another thing that's associated with behavioral issue is sensory issue. So biting, head banging in the children with autism is associated with sensory issue. So what you can do is you need to go to occupational therapist and do a sensory integration disorder check, so that therapist can provide appropriate sensory intervention to your child in order to reduce the behavior. Okay, because I think that this behavior is associated with sensory issue. Okay, all right.
He also mentioned that his son has problem communicating. So will the use of visual and behavior program or OT work for the teenagers?
Yes. All right. So that's why I asking the question. So probably Miss John's son have a problem in communication. So that's why he always have a meltdown. Okay, so that's the issue as well, because it's very difficult for him to express the emotion, what he needs. Okay, so that's why he getting irritated every day.
Okay, he's thanking you, Doctor, from the chat box. Okay, the next question comes from Mr. Nazrul Amin. My sister is autistic. She is now 29-year-old, but her self-help skills like 3-year-old. Is there any hope for the future?
Okay, so like a 3 years old. So of course, again, it depends on the severity of autism of your sister. Okay, so but again, let's say that the IQ level is very low. Okay, you may start with the graduated guidance. Okay. Including for the menstrual care. This is very important for the girl, okay, menstrual care, as well as for the toileting, okay. All right, we need to teach team step by step until the child can do it independently. As I told you earlier, it's a lot parents out there have frustration, regrets, and lost hope because teaching children with autism is much more difficult than the other disabilities such as Down syndrome. Okay, in fact, if we teach to the Down syndrome, individual, they can do work. Okay, but it's vice versa for the children with autism. Okay, but again, it's depend on the severity symptom of the autism and the cognitive function of the individual. Okay, right. Okay, to know the better technique, okay, you may visit to occupational therapists to get opinions, because if you ask here, I cannot conclude it because the technique should be considered a lot of factors before we can suggest you the best technique for you to choose or to be done with your sister. All right.
I was smiling while asking the question because Mr. Nazrul is part of our team.
All right.
All right. Next question comes from Miss Darshini. How to know the perfect technique that suit the child? Okay, the children. Should it be used based on age or based on the behavior?
All right. Okay, this is very interesting question. So what I can say to Darshini is know the child better before you intervene or before you choose the technique with the child. Okay, you can always get the information from the parents first. If you are OT, you can always gather the information from the teacher first before you can use the technique with the parents. So what I can say here, in order to choose the best technique, you should know the child better. You should know the child interest. You should know the development of the child. You should know the asset of the child in order to choose the best intervention. Okay, so again, it's depend on the condition of the child as well as the other factor that influence the self-help skill that I discussed before in the slide. Okay, so let's say that the child is profound IQ. Okay, which is the IQ is less than 20. Okay, so graduated guidance is the best way to be used with the child. Okay, let's say that the child have very mild IQ level. Okay, so you may use prompting and just a verbal instruction to the child to get the targeted behavior. Okay, so what I can say is know the child better.
Okay, thank you, Doctor. Another question comes from Miss Anissa. Can autism be fully treated? Means can autism can be a normal kid after treatment?
Okay, Puan Haniza. So that's why when I delivering my intervention to the parents, so I always to be careful with the word that I use with the parents. So Haniza, actually autism is autism. You can minimize the symptom, but you cannot make it your child like a normal one. Okay, so so of course, normally after the session with parents or with caregiver of autism, I will always say sorry if I use a harsh word during my session. Okay, because I know that you also have hope. You also have hope for your children. You also want your children to be normal, but sometimes we have to accept the condition and let the children live their life with the autism spectrum disorder, and we can always minimize the symptom from time to time. Okay, so that is the fact that you should accept. Okay. Right. Okay. I'm sorry again, Puan Haniza. Okay, for letting you know the answer.
Means that what we can do is just to help the child, okay, to minimize all the what we call that all the behavioral problem, all that, right?
Yes.
Become a normal, it is like impossible. Is it like that?
Yes.
Okay.
Okay.
Right. Okay.
even the children with mild autism as well, we can still look at the features of autism. Of course, when they go to a university, when they go for tertiary education, there is a symptom that makes him unique as compared to their peers. Okay, all right.
We can consider them as a very unique person.
Yes.
Right?
Yes.
Okay, Mr. Josh again asked one question. Wait, I'm looking at the chat box here. Where can we seek sensory integration help?
Okay, you can go to hospital. You can go to any independent center that provide occupational therapy service. Okay, all right.
Okay. From Ms. Nazilia again, is UiTM Puncak Alam providing the sensory assessment test?
Yes. I think Miss Fatin from my department can help with this. Okay, right.
Okay, so I think there is one last question. There are two questions. This one come from Mr. Gan Jinying. Good afternoon, Doctor. Which strategy or technique will you suggest to train toileting skills in children with ASD, and why that technique you suggest?
Okay. Miss siapa tadi?
From Mr. Gan.
Mr. Gan. Okay, Mr. Gan. So again, in order to choose the best technique, so of course I need to assess or I need to assess the cognitive function of the child. So let's say that if she or he able to follow the instruction, I will go to prompting and feeding plus reinforcement. Okay, just for that to improve the toileting skill. Let's say that the child have very low cognitive function and have a sensory issue. So of course I need to treat sensory issue first before I can train the child using graduated guidance if the child have a low IQ level. Okay, it's depend on the IQ level, it's depend on the sensory or the problem that the child have. Okay, so because we know that there's a lot of associated problem with the heart skill problem. Okay.
I think we can take one more question. I think it's very long question. Doctor, can you read from the chat box? Can you see it from Miss? I'm not so sure, Miss or Mr. Chan.
I couldn't see.
Okay, let me read it for you.
The last one I can see is YouTube channel link only.
Okay, it's okay. Okay, let me just read it out. My 25-year-old son is a high-functioning ASD or Asperger syndrome. We missed the early intervention for him until 13 years old while attending a private secondary school. Thereafter, we sought help from psychiatrists, and currently he is on quarterly appointment at HUKM psychiatrist department. We have been facing especially his problem on stubbornness, on certain social issues or human relationship, virtual relationship with a girlfriend. Though he has no problem in taking his medications daily, this stubbornness occasionally brought about certain level of meltdown, such as throwing laptop or mobile phone and faulty after that. Can anything be done to alleviate such problem?
All right. So for high functioning autism, I would suggest self monitoring the behavior. Okay. So the technique that I discussed before, if the child have a good insight, meaning that he is willing to change as well, we can use self monitoring behavior. Okay. So you can have a mutual discussion with your child and use self-monitoring technique in order to reduce the stubbornness of the child. So, but again, this is common problem. I think this is common problem among high functioning children with autism, because he or she thinks that he is better than the other, and he speaks very loud, and he like to throw their own idea, and he would like to disregard the other idea. Okay, that is common problem among the children with autism spectrum disorder in the adulthood. So that's why it is it's make him or her unique as compared to others. Okay, all right. So I would suggest self monitoring the behavior.
Okay, Doctor. I think we can take last question because we're now over 12:30 already.
All
From
right.
Mr. Zainal Abidin. Where can we test our IQ level of our child? Normal
Okay.
OT can assess the child IQ level. I think he asking either normal OT can assess the child IQ level or not.
Normally, occupational therapy do not assess for IQ level. So it's either done by the clinical psychologist or psychiatrist. Okay, right. So go to psychiatrist or psychologist to do for IQ level test. Okay, all right.
Okay, thank you, Doctor. Thank you very much.
I
It seems that
I
we
had good
have.
session with you all. Okay, thank you very much to
Doctor,
those.
don't go yet. Don't go yet. Okay. Do you have anything else you want to conclude?
I think that's all for today. So I just would like to thanks to all for having me here, and don't afraid to call me again to share this in this session, and I'll be very happy to share with you guys.
Okay, again, thank you, Doctor, for your precious and valuable tips and time. I'm sure all of us, including today's audience, have gained a lot of information that will be beneficial to our autistic children, not only autistic, but only applicable to other special need children like my daughter, which has Down syndrome. Okay, and as for the others, please feel free to fill out the feedback form for e-certificate and jam latihan for your attempt staff. Please, I remind again, please provide correct name and valid email address as it will be used for the e-cert. We will email it to you. If you use a nickname, then it will be printed as nickname. So it seems that we have come to the end of our webinar today. We would like to extend our deepest appreciation and gratitude to all of our distinguished participants for being here with us today. And just to remind you that our next webinar will be held on 12th December, and we will bring you the topic on Run with Autism. So it will be presented by Mr. Muhammad Zukaida. He's a proud father to an autistic child named Zarif. He's an avid runner, passionate in autism cause fundraising running project since 2017 via Run for Autism platform. So during the webinar, Mr. Zhu will share his experience and challenges in upbringing Zarif and how he used running to advocate about autism. It is very interesting topic. So we hope that on behalf of the NRC, we hope that to see you again in 2 weeks' time. Assalamualaikum and very good day. Doctor, can you wait for a while? Yeah?
All right, sure.